morning. Good morning. Ride with me as we go into another city in Alabama on my way to a site. Safety first, so I will not be directly looking into the camera, but paying attention to the road. I just wanted to talk about this morning about the importance of source documentation. The best source documentation is going to help you prevent completing protocol deviations. When you outline your source directly from the protocol and you add those little footnote reminders within your source, it helps you to prevent protocol deviations. For example, say for instance that you need to take a vital signs, EKG, labs, and then administer the medication. And per the protocol, it goes in a specific order. Like they want the labs drawn after the EKG, so the person won't be, their EKG won't reflect any pain or discomfort that they had from the needle stick. And or they want their vital signs sitting in the sitting position, and that person needs to remain sitting and quiet and still for at least 5 minutes. Not doing those things is a protocol deviation. So even if you got the vital signs, even if you got the ECG, even if you drew the labs, if you didn't do it in the order protocol, whichever assessment is out of order is going to be considered a protocol deviation. Another thing to note, say for instance that they want the vital signs after the medication. So they want the participant to be observed for a period of time, and then they want the vital signs taken at that time point. It's very important that you adhere to that time point. So if that time point is set for 30 minutes, if that time point is set for an hour, you want to make sure that you take the vital signs within that time point. Now, oftentimes you have maybe a plus or minus or a plus time, maybe 5 minutes or 10 minutes. You have a window because we know things come up, and you might not be able to do things at that exact time point. But whatever that window is, 5 minutes, 10 minutes on the plus side or negative side, you want to make sure you stand within that window. Because these things are put into place in the protocol for safety reasons. Or they're put into the protocol to make sure that the readings are accurate. And so they don't want to get a false high blood pressure or a false heart rate on the EKG because a person has been frustrated from multiple needle sticks. Just say for instance, the labs should be drawn after the EKG, and you stuck that person 2 or 3 times and had to go get somebody else to stick that person before you were able to maintain that lab drawn. That person is now probably in pain. That person is now probably is irritated. So now their heart rate is up. Now the possibility their blood pressure is up. And so that's going to manifest possibly on that ECG. So we want to make sure that we adhere to the protocol.